All right, fielding. So we are about 2 weeks since you've had your surgery, correct?
Yep.
Perfect. And you've been dealing with a little bit of extensor lag, not really been able to use the quadricep muscles to move your knee, right?
Exactly.
Perfect. So one thing that we can do for you is electrical stimulation. What that does is send some electricity into the muscles themselves and causes them to contract. And by doing so, it'll stimulate the muscles so that you can kind of rewire your brain and are able to actually use some of those quads a little bit easier. You don't have any kind of history of cancer, do you?
No.
Okay, perfect. And there's also no impaired sensation anywhere here on your lead. Like you can feel my hands as you touch you.
Oh, yeah.
Perfect. So what this will look like, and there's no area of any kind of like rash or scarring from the surgery. Perfect. So what this is gonna look like fielding is I'm gonna place these pads here on your skin, and these are connected to this machine here. And what I'm gonna do is increase the intensity, so you'll start to feel some electricity running through your leg. Just kind of feel like a vibration in there. And I'll just continue to increase the intensity until it's kind of a threshold for you and you want me to stop. And so the machine is going to contract for 10 seconds. And as the machine contracts, what I want you to do is focus on facilitating the motion and contracting your quads yourself. And then it'll stop for about 10 seconds. And then it'll go again and stop. And we're gonna do that for about 10 minutes. Any questions about any of that?
So I relax in between?
Yep, so when the machine is off and it's not sending any pulse to your legs, relax. And then when it's sending a signal, I want you to focus on doing your best to flex the quads.
Gotcha.
Cool. Muscle bellies. Alright, so I'm going to be turning this on for biphasic 1 second ramp. Our time for 10 minutes. Our rate is going to be 80. And our width is going to be, we're going to do 300, which is on the lower end for now. And when we start to do this a little bit more, we can start to increase it a little bit. So I'm going to start sending a signal through from the machine into the channel, and I want you to tell me when you can start to feel kind of vibration there in your leg. Sounds good.
Starting to feel it.
Okay, starting to feel it. So I'm just going to continue to gradually increase it, and I just want you to let me know when it's kind of a threshold of when you think it's starting to get painful, and just tell me to stop, and that's where we're going to stop.
Gotcha.
Keep going.
Yeah.
All right.
Ooh, right there.
Okay. Awesome. So I'll go ahead and start it. So yeah, when it contracts, go ahead. Yep, contract as much as you can. Looking good. Looking good.
Hold it the whole time?
Yep. And now relax. And then she'll let you rest for about 10 seconds with a 1 second in between to recover from. Oh, excuse me, it's a 30-second lag. For right now, since this is something that's kind of new, we do want to let the muscles rest a little bit. So yep, go ahead and contract as hard as you can. Looking good, very well done. And then yep, just totally relax. All right, perfect. So it's been 10 minutes now, so we'll go ahead and stop it, and I'll take these off yet. How is your leg feeling after that?
Tired.
A little tired? That's totally normal. That muscle hasn't been having any kind of contraction lately. And this is forcing one, so it's probably gonna feel some effects of the inside. Let's see, the skin's looking good, not too red anywhere, no signs of infection either. We'll probably throw some ice on your fielding and we'll call that good for today.
Sounds good.
Wonderful.